So let's discuss together related to your life's concern because you were like saying you were studying. So what trouble do you still have studying?
It's like I'm studying, but I don't know what to study.
Okay, you
So
don't
I
know.
guess I need like what to do, you know,
Hmm.
start doing this first or start doing that second or just organization, I think. Cuz
Okay.
I'm just going on U World and doing questions.
Okay.
Mhm.
All right. All right. So we are going to fix that today. So that you can know what to do, how to prepare, and then pass the NCLEX exam.
Yes,
Right.
sir.
So yeah. So let's talk about how to prepare and pass the NCLEX exam. Now, you want to take the NCLEX, and what you want is to pass. Like every student wants these three things: to pass, freedom, and the last thing students want is fulfillment. Right? You want to pass, right? When you take the NCLEX exam, you want to pass, you want freedom, you want fulfillment. Right. Obviously, you want to pass because if you don't pass, you will not become a licensed nurse. Freedom, many students will say, I just want to take this exam and be done with it. I don't want to ever take it again. That can only happen when you pass the exam. Right. And fulfillment, that is you becoming a licensed nurse. So those are the three things that we want. But in order to achieve these three things, it all depend on this, right? Effort and results. Right. Effort is your preparation, right? And then result is either you pass or fail. Now, if you have the right effort, you will get the right result. But if you have the wrong effort, you are going to get um the wrong result. But the goal is for you to have the right effort so that you can have the right result, which is to pass the exam. Now, in order for you to have the right effort, there are three things you need to have, right, in your preparation. Now, the first thing you need to have is how you study. The second thing you need to have is how long you study for. And the third thing is how much how much time you spend studying each day. Right. So these are the three things that make up your effort, which is your preparation. So your preparation includes um how you study, how long you are studying for, and how much time you spend studying each day. Right. Every student pretty much have this. They are studying something, they are studying for a certain amount of days or week, and they are spending some amount of time studying each day. But remember, we said if you don't have the right effort can include all this. But if it is not done right, you will get the bad result. But if it is done right, you will end up getting the good result. So the goal of this whole discussion is to make sure you have the right way to study, how long you are studying, and how much time you are spending studying so that you can get the right result. Right. So now let's talk about the first one, which is how you study. So I'm just going to like erase all this on the screen real quick. Right. So how do you study? Let's talk about the first one. So I'm just going to like put part one, which is how you study. Now, I will tell you what I have seen for the past 4 years of coaching. Now, because one thing I observe is first time test taker happen to be 80% pass rate, right? And then repeat test taker happen to be 37 to 50%. And in my head, I'm like, somebody that is a first time test taker and somebody that is a repeat test taker, right? Now, let me just put test taker, right? First time test taker and repeat test taker. Now, this kind of student, they have not seen the exam before, but these students have seen the exam. So this student should be the one to have the highest what? Pass rate. But guess what? These are the students having the highest pass rate, and repeat test taker are having low pass rate. Right. Repeat test taker not only have seen the content and the question, they also got a report that told them how they perform. And from that report, they can use it to go and prepare again in order to pass the exam. But first time test taker have not seen all that. So it's only um tell us one thing, which is repeat test taker are seriously struggling because of what they keep doing wrong. Right. So it means before you are going to be a repeat test taker, there's something you are doing wrong and you've not yet fixed that thing. No matter what you are doing in order to prepare for the NCLEX exam, you are still going to keep failing the exam. Why? Because you've not fixed that particular thing. Right. So, but until you understand what students are doing wrong, you will not know what to fix. Right. So that is what I did. I tried my best, like, to understand why many students are failing the NCLEX exam. So I spoke with over 500 students, and I got to realize something. Now, when a particular student is trying to prepare for the NCLEX exam, right, the first thing they always used to think of is to get a question bank. That's the first thing they think of. I want a question bank. Now, when they fail the NCLEX exam, they now blame it on content. They're like, oh, I feel the NCLEX exam, it look like I don't know content. So they start studying content, right? And they start practicing, um, they start practicing questions. Right. So they instead of doing just this now, they are doing the combination of this. Right. Now, mind you, some people use question bank, they pass. Some people use question bank, they fail. Right. But I'm talking about students who use question bank and fail. When they fail, they blame it on content. So they start studying content and practicing question. Right. Now, when they study content, practice question, some percentage is going to pass and some percentage is going to fail. Now, the one that fail will now start saying, oh my God, but I study content, I practice question, and I still fail again. What's the problem? Now they start thinking it's the program. So now they start switching from one program to another. So they start saying, oh, what program can help me pass the NCLEX exam? Or maybe if they notice somebody passed the NCLEX exam, they start asking, what program did you use to prepare for the NCLEX exam so that I can get that program and use the same thing as well? Right. Now, those people that decide to switch from one program to another, some percentage end up passing and some fail. At this point, they have no other thing to do because they have used question bank, they fail. Study content and practice question, they fail. They switch program, they still fail. Now they are like looking for help, on how to pass the NCLEX exam. Now, you see, this is the routine a lot of students take, right? Most of them along the line they succeed. Most of them along the line, like most of them they don't get to like succeed, right? So now that made me understand one key thing because from what every student are doing, right, I realized that a lot of students just involve themselves in preparing for the NCLEX exam without knowing how to prepare and pass. It's just like trying to play a game without knowing how to play the game. Right. You might get to lose level 1, learn from your mistake, and then win that level again. Or you might try maybe up to 5, 6, 7 times before you win that level, and you're like, "Oh, thank you, thank you." Like you're happy, you won that, but you have to like lose 7 times before you figure out how to win that level. Right. That is the game most students play. They don't understand how the NCLEX work. They just get into preparation, hoping they will pass. Now, when they fail first attempt, they try to learn from what they did wrong. They try second attempt. Some people will be lucky to pass second attempt. Some will not be lucky. So they have to start going from 3, 4, 5, 6, all the way to 12, 15, I have seen. Right. But the moment you know how to study, you will know how to pass the NCLEX exam. How you study, you know how to pass the NCLEX exam. Now, passing the NCLEX exam is not about what you are doing or using. Passing the NCLEX exam all come from you knowing how to pass. Right. Once you know how to pass, right, you'll be able to pass the NCLEX exam. Right. So a lot of students only have what they want to use to prepare for the NCLEX exam. They don't know how to pass. And when you don't know how to pass, you can have what you need to use, but you are still going to end up failing. The difference between student A and student B who is passing and student B who is failing is that student A know how to pass, student B don't yet know how to pass. And that's the reason why you can see students, right, using the same program. Maybe one student will use U word, another student will also use the same U word. Student A will pass using that U word program, student B will fail using that U word program. But it's the same program. So why is it that this student end up passing and this student fail? Because this student know how to pass and this student don't know how to pass. Right. Come to think of it, right? McClimick happened to be someone who has worked with the NCLEX before, helping them to write the question. So he has all the knowledge about the NCLEX and he created a program. And guess what? Despite the fact he put all his own NCLEX knowledge in creating this program, we expect that any student should use this program and pass. But guess what? I've been coaching for the past 4 years, and I will still see students reaching out to me, and I will ask them, "What program have you used previously before?" Some people will still mention Mark K. So, meaning it's not because Mark K is a bad program, but it's because program is not what make you pass, right? What make you pass is you knowing how to pass. If you don't know how to pass, you can use the best program in the world, and you will still fail the NCLEX exam. Right. Now, last explanation I'm going to give related to this, right, is let us say you want to cook a particular meal. You are going to agree with me that in order to cook this meal, having the right ingredients is not important if you don't know how to cook. If you don't know how to cook, you can have the right ingredients, you are still going to prepare trash. Right. But if you know how to cook and you have the right ingredients, you'll be able to cook a nice meal. If you don't know how to cook, if you give this ingredient to somebody that knows how to cook, this person will be able to cook a nice meal. That's the reason why you can have somebody using U word and have another person using U word. If this person know how to pass the NCLEX exam, they will use this program to pass. But if this person don't know how to pass the NCLEX exam, they will use that same program and fail. That's why you can have the right ingredients. But if you give this right ingredient to somebody that don't know how to cook, they will prepare trash. But if you give it to somebody that knows how to cook, they will cook a nice meal. So that is how it works. Right. Now, for you to pass the NCLEX exam, there are 3 things you need to understand. But for you to prepare to pass the NCLEX exam, there are 5 phases. Now, to know how to pass the NCLEX exam, there are 3 things, like I said, you need to understand. And those 3 things are part of the 5 phases. Let me write them on the screen. Like, for you to pass the NCLEX exam, right, to pass, there are three things you need to know, right? To prepare, we have 5 phases that should be in your preparation. Now, these three things are part of the 5 phases, just 2 additional that make preparation equal passing if you do it right. Now, in order to know how to pass the NCLEX exam, these are the 3 things you need to know. One, you need to understand the NCLEX. Very important. A lot of students don't understand the NCLEX. A lot of students don't understand the NCLEX beyond the NCLEX is a licensure exam, or the NCLEX is an exam I need to pass to become a licensed nurse. But the real question, like we said, how do you pass it? If you don't know how to pass it, you are going to prepare wrongly. It's just like somebody that got invited to a party but never tried to understand the kind of party. And then you came all dressed up to the party and you realize you were dressed wrongly for that party. And then you're like, oh my God, so this is not how I'm supposed to dress. The reason why you dress wrongly to that party is because you failed to understand the kind of party. Had it been you try to understand that party, you would have dressed well to the party. So the reason why a lot of students fail the NCLEX exam is because they miss out on this. They don't understand the NCLEX. And when you don't understand the NCLEX, yes, you will show up, but you will not get the right result. Right. So now when you understand the NCLEX exam, 3 things happen. You get to know how the NCLEX work, right? You get to know how the NCLEX work, right? What it tests, right? How the NCLEX work, what it tests, and how to pass it. Right. Or let me just put it this way. You get to know, there are 3 things you get to know, right? The first one, you get to know how the NCLEX, let me just put work, how the NCLEX work. When you know how the NCLEX works, you get to now know how to pass it. And when you know to pass it, you need to now know what the NCLEX is. So you get to know what the NCLEX test. Right. So those are the 3 things. Now, when you understand how the NCLEX works, you know how to pass it, you know what it tests. Then you are ready for the second thing, which is you need to understand the content. Now, the truth is, a lot of students, when they don't understand the NCLEX, they don't know this, and they don't know what the NCLEX is. So they study things randomly. They can buy a program and start studying things randomly. Now, there are 2 ways you can understand a particular content. One, as a nursing student, and 2, as a nurse. Now, you can have the same content, but if you take for instance, let us say it is advanced directive that is the content. Now, you can study this content as a nursing student, and you can still study this content as a nurse. Now, when the NCLEX want to test you related to this content, NCLEX don't test this content to you as a nursing student. NCLEX tests this content to you as a nurse, meaning you can have the same content, but they are tested in different ways. But a lot of students are used to nursing students' way of studying and nursing students' way of taking exam. A lot of students are not used to NCLEX way. NCLEX tests you as a nurse. So if you fail to know what the NCLEX tests, you cannot be able to study the content and have the right understanding to the content the right way. That's why you will see students, they will reach out to me and they say, but coach, I knew majority of the content that NCLEX tested me, but I still failed the NCLEX exam. I don't know why. I'm confused. And truly, when you ask them to go through questions, they can identify the content. But the problem is not that they don't identify the content. The problem is they have studied that content wrongly. And when they are about to apply that knowledge, it's impossible for them to apply it because the question is not clear based on what they have studied wrongly. So that's the reason why you need to know the right content NCLEX test so that you can now have all the list of those contents and study them and have the right knowledge to those contents. Now, the NCLEX tests what we call nursing activities. Right. It's very important to know this. Now, in nursing, like nursing is divided into 2 parts. Let me explain nursing because many people don't like understand this. Now, nursing is divided into 2 parts. You as a nursing student and you as a nurse. This is for your nursing school, and this is for the NCLEX. Right. The goal of nursing school is to give you all the nursing information that you need to become a nurse. So nursing school is there to give you all the nursing information you need to become a nurse. The goal of the NCLEX is to test you related to how you use this information to carry out nursing care. You see, this is what NCLEX tests, nursing care. NCLEX don't test nursing information. NCLEX just want to see how you use this nursing information in nursing care. But the way a lot of students are still studying is related to nursing information. So there's no how you will go on the NCLEX exam and be able to pass that exam. It will be difficult. You might succeed, but it's going to be so difficult. Why? Because you are studying wrongly. NCLEX don't test nursing information. NCLEX tests nursing care, but based on that nursing care, you apply nursing information. But you need to understand the nursing care before you can apply information. But a lot of students only know their nursing care, their nursing information, they don't know their nursing care, and that's why they struggle. NCLEX questions are written in form of nursing care, nursing activity. Right? So NCLEX tests nursing care or nursing activity, anyone you want to call it. That's what NCLEX tests. So if any information you are going to be studying will be related to topics, but NCLEX don't test topic, NCLEX tests nursing activity. So that is the first thing you need to know. Like, what are you studying? Now put two nursing contents on the screen right now. Right. I'm going to put two nursing content. Now, the first content is advanced directive. And the second content is integrate advanced directive into the client plan of care. Now, one is a topic, one is nursing activity. Right. This right here is the topic. This right here is the nursing activity. Why is this a nursing activity and why is this topic? Because this is not telling us anything. It's just naming the topic. But this is telling us what to do as a nurse. It's telling you that, okay, you should know how to integrate advanced directive into your client plan of care. But this is not telling us anything. Now, when you are studying something like this, you see they both advanced directive, but presented in different way. This one is presented in form of topic. This is presented in form of nursing activity. If you have to study this, you will be left guessing what is going to show up on the NCLEX exam. So in your head, you will be like, probably NCLEX might test about the definition. Probably they might test about the type. Probably they might test about the ethical guideline. But if you are to study this, you are not guessing. You are sure what the NCLEX will test. When students go on the NCLEX exam, or maybe I ask them to break down a particular question and I ask them, what is this question testing? The reason why they don't know what the question is testing is because all what they are studying is topic. If you study nursing activity, you will be used to things nurses do. When you see that question, you'll be able to tell me this is what this nurse is doing right here. And when you can be able to figure out what the question is testing, you are one of three, having that ability to answer that question correctly. Right. Because you need to do three things correctly to be able to answer a question correctly. One, you need to be able to figure out what the question is testing. When you are able to figure out what that question is testing, the second part is the part that we are talking about now, understanding the content. Now, you know what the question is testing, you have the list of everything NCLEX tests, then you study them. Now, a lot of people, when they study content for the NCLEX exam, they study it the wrong way. Right? Or they study in a way that everything starts looking overwhelming. They feel like they are trying to study a lot, or they start studying so much that they struggle with retention or they struggle as a slow learner. Right? But once you have the right content, you have all your list and you study them the right way, you will get the right knowledge and you'll be ready for the third thing, which is for you to understand the question. Right. So the number one thing when you're trying to answer a question, you want to know what that question is testing. When you know what that question is testing, you want to be able to apply the knowledge. right, related to what the question is testing, right? That's the number one thing. Now, understanding the question, right? It's very important to understand question. Like I said, nursing content is divided into two parts: nursing school and NCLEX. Yeah, the same nursing content, but it can be tested in different way, right? So same thing, the same nursing kind of question, but tested in different way. The way nursing school tested you is different from the way NCLEX is testing you. The goal of the NCLEX is to do this. I'll put it on the screen. The goal of the NCLEX is to test you related to various nursing activity. Now, based on this nursing activity, they want to see how you act, right? And how you act will show if you are a safe and competent nurse. That is how NCLEX works. So based on this goal, that is how NCLEX writes the question. A lot of students don't understand this because they are used to straightforward nursing school question. So when they even have the right content knowledge and they see NCLEX question, they still struggle. They still get stuck between two answers. They still feel like every answer in that question is correct. They still try to figure out to answer the question and they are still struggling answering the question. Why? Because they fail to understand this. Now, nursing school question is not the same as NCLEX question. That is why you need to understand NCLEX question. It's just like somebody who knows how to drive, but is only used to driving a Benz. And now you're asking this person to drive a Lamborghini, right? Now, the problem this person is going to have is not because this person don't know how to drive, but the way of operating a Lamborghini is different from the way of operating a Benz. But if this person learn how to operate the Lamborghini, they will be able to drive it. So the same thing applies to nursing students or nursing graduates preparing for the NCLEX exam. Most of them know their contents, but the problem is they are only used to nursing school questions. But when you make them understand how NCLEX question work, now they can now apply that knowledge to the NCLEX question. The only problem most students have is they don't understand how NCLEX work. And that's the reason why you need to know how the NCLEX writes the question, how to break down and answer the question. You need to learn proven test taking strategy, and then you need to practice past questions. That's what you need to do. Practice past questions. So these are the 4 things that make you have a clear understanding of NCLEX question. So how does the NCLEX write their question? When NCLEX want to write the question, remember, NCLEX write the question, test you related to nursing activity. They want to see how you act, and how you act will show if you are safe and competent nurse. So there's a part of the question that describe this nursing activity. That part is the body of the question. The body of the question describes that nursing activity. When you read the body of the question, you will be able to understand that, oh, this is what they are testing me as a nurse or the nurse in that question. You understand the nursing activity. When you understand the nursing activity, it's something you have studied. You studied it. So since you studied it, now you will start remembering everything you studied about that nursing activity. Now you are preparing to act based on that nursing activity. Now, the NCLEX will now tell you how to act. So that part that will tell you how to act, that part that is going to tell you how to act is what we call the stem of the question. The stem is the examiner question that is telling you what to do related to that nursing activity that the question is testing. Right. Now, this part, which is safe and competent nurse, which is showing that you are safe and competent nurse. The way you are going to show that you are safe and competent nurse is from the answers, the provided answers. Right. That's the third part. So the answers, you are now going to select the correct answer. When you select the correct answer, you are able to now show that you are a safe and competent nurse. That is how the NCLEX works. So now when you are trying to answer any NCLEX question, you are looking, when you are seeing your question now, you are trying to find out what is the body of the question so that you can read it to identify the nursing activity in that question. That's what you want to do. Because if you don't understand the nursing activity in that question, you are going to agree with me, you will have no knowledge to answer that question. Right. You have no knowledge because you don't know the nursing activity, so it will be difficult for you to answer the question. NCLEX is not difficult. You've not just done the right thing, and that's the reason why you keep struggling at it. But once you can do the right thing, you'll be able to pass. The right thing related to answering any question, the first thing you want to identify is that nursing activity. If you have difficulty identifying that nursing activity, then you will not be able to answer the question. You'll be left with guessing through that question. Now, but if you identify the nursing activity, now you want to now know how the examiner wants you to act related to that nursing activity. That is when you now figure out the stem of the question. Then you read the stem and then you are like, oh, okay, this is what this stem is asking me to do. That is the examiner question. This is what the examiner is asking me to do. This is how the examiner wants me to act. And then you act accordingly, right? And after, when you understand the stem, then you will now need to go through each answers to identify which answer will be correct or which answer will show that you are a safe and competent nurse based on what the question is testing or based on the nursing activity the NCLEX is testing and the way the examiner wants you to act, which is the examiner question. And that's how you get to select the correct answer. The only thing that will stop you from selecting the correct answer, right, is if you've forgotten what you've studied. In as much you remember what you studied, you'll be able to answer the question. So this is the three things that give you the ability to pass, right? But how do you prepare? Right. How do you prepare? Because it's not about knowing how to pass. It's about also knowing how to prepare. Remember we said prepare and how to pass. So let me just take this off the screen. So how do you prepare for the NCLEX exam? We have 5 phases. Right. The first three is pretty much what we've discussed before. Understand the NCLEX, understand the content, understand the question, exam readiness, and final exam preparation plan. Right. So this is what your preparation should include. This is how you prepare. Right. You want to start by, when you are preparing for the NCLEX exam, you want to start by, how you prepare is also the same thing as how you study. Right. So when you want to start studying, you want to start by understanding the NCLEX, because if you don't understand the NCLEX, you will not know how to pass it. You will not know what the NCLEX test. But when you understand the NCLEX, you will know, oh, the NCLEX test nursing activity. So everything I need to be studying should be related to nursing activity. Right. At this point, you are like, okay, where can I get the nursing activity to study? Right. At this point, where you are going to get the nursing activity is the NCLEX test plan. That's where you're going to get the list of nursing activity NCLEX tests. Now, people are like worried, oh, the NCLEX is going to change today. The NCLEX is going to change today. Right. Nothing is changing about the NCLEX. They only just like the content which they test, which is the nursing activity. Some few, like let me say 2 new content got added. That's all. Right. Nothing is changing about the NCLEX than they always used to revise the content every 3 years. Right. They go, how do NCLEX get the list of content to test? Right. Remember, NCLEX tests you as a nurse. NCLEX tests nursing activity. So the NCLEX board people are going to go to different healthcare settings and they will start talking to like about 12,000 newly licensed nurses, and they will ask them what kind of care did they perform in their first 1 year of becoming a nurse. So this 12,000 licensed nurses will list all the care they perform. So all this care they perform will be turned to the content NCLEX will test. So every 3 years they do that. So they've done that last year. They reviewed the content. 98% of the content are still the same. Few got added, but they are still pretty much the same. Right. So that is the content. Right. NCLEX is doing this research so that you can be able to study those content, so that when you go on the NCLEX exam, you can be able to see those content and pass. But the problem is many students don't study using the test plan. They study using different things, and that's why you student keep struggling. Right. But when you study using the test plan, the content right there, you know the content that will be tested, and you have the right knowledge, you are ready to answer question. Now, you don't just jump straight into answering question. You want to know how NCLEX question work. I know how the NCLEX write the question, how to break down the question and answer them, right? You also want to know proving, test, taking strategies, and you want to practice using past questions. Once you can do this, good, you are done with the first 3 phase. Now, when you're done with this, you know what the NCLEX test, you've studied the content, you have the knowledge, you've practiced question, you feel you are ready. So you want to check readiness. Now, when students try to check readiness, they do it the wrong way, because you will see students going to go do 85 question or do 150 question or do 100 question. This is not how to check readiness. And you will see many students will say, oh, but before I took the NCLEX exam, I did readiness assessment, and they told me that I am passing, but I still failed the NCLEX exam. Why? Because this is a false readiness, right? This is a false readiness. In order to get a true readiness, you don't answer question. Instead, you do not only just question, but you start with the content. Right, that's what you do. You start with the content before question. Now, so you are going to now go back to that test plan again. You see, like previously before, NCLEX have 146 content. Now, the one that got updated today now is 148 content. Right, for RN. Right, 148 content. So now all you now need to now do is to go back to that 148 content now. I have the list of those content. In front of it, I have a box, or whichever way you want to like check. Now, this one means strength, this one means weakness. So if it is the first content, integrate advanced directive into the client plan of care. Are you strong with this content? You will ask yourself, if I happen to see question on the NCLEX exam related to this content, will I be able to answer it correctly? If yes, it's your strength. If no, it's your weakness. You do that, weakness, strength, and then you evaluate yourself. Right. Now, let us say you have this one as 2 weakness and 3 strengths. So at the end of the day, you have total 3 strengths and 2 weakness. Now, all you just need to now do, right, in order to tell yourself or say to yourself that you are good with content, you need to have 70% knowledge, like 70% knowledge. So now, how do you evaluate this? You pick the smallest number, you put 2 divided by 3, right? 2 divided by 3, right? You get something like 0.66, then you multiply it by 100, so you will get 66%. So you see, it's not more than 70%. At least your content knowledge should be more than 70%. Right. It can be the reverse. It can be that at the end of the day, let us say you only know your weakness is 2 and your strength is 2 and your weakness is 3. Same thing, divide 2 divided by 3, 66%. It means that your weakness is more than your strength, and you have like 34, percent strength and weakness. Right. So that's how you try to know if you are good with contents. It must be above 70%. So then you'll be able to tell yourself, oh, I still need more work to do. You know you are not ready to even take readiness assessment, talk less of even taking the NCLEX exam. Right. So now once you are done with that part, right? Now you will be able to see and say, okay, sometimes you evaluate yourself. Truly, you need to be honest with yourself, because you know you don't want to go joke on the NCLEX exam. You might evaluate yourself and then see, oh, you are more than 70%, which is good. It shows you have a very strong content knowledge, right? So now, since you've shown you have a very strong content knowledge, there's nothing bad in also trying to work on these 30% and turn them over so that they be part of, the additional, additional to the 70%. Right. So the whole goal is not just to know your strength. The whole goal is to also work on your weakness and then turn them to strength. Now, once you are done with that part, that is when you now answer readiness questions. So now you know, okay, I have evaluated myself that I know my content. Now I'm ready for question. Now, when you end up passing your readiness assessment, you can now tell that that is a true readiness. It now shows that you are ready. So now you are not ready for the final part, which is the final exam preparation plan. Now, what you do here is very simple. Right. Now, NCLEX, out of the 148 content NCLEX test, there are some certain contents, about 34% of those contents that repeat on everybody exam every single time. It's a must. It's a must. Prioritization will always repeat itself. Medical condition will always repeat itself, right? Pharmacology is also always going to repeat itself. Case study, both-eye question, chat question, you name it, a lot of content. Infection control, right? A lot of content always will repeat themselves. Now, if you can prioritize on those content that always should repeat themselves, though you've studied them, yeah, but you just want to prioritize them now in your final exam preparation, right? To restudy them again, and you start studying them 24 hours before your exam. Now, many people will say, when it is closer to your exam, you need to rest, you don't need to do anything, don't study. The truth is, if resting was important, you will not be on the Zoom meeting now. You will be resting. But resting only happen when you end up becoming a registered nurse. Right? That's the only time you can rest. Because if you've not passed the exam, there's no rest for you. You keep panicking about the exam. You are still trying to figure out how to pass it. You still wake up in the middle of the night, still remembering yourself that you need to study today. So there's no rest. So, but you can use that 24 hours the right way that it help you out in passing the NCLEX exam. Right. Now, when I was preparing 24 hours to my own exam, most of the thing I studied 24 hours, most especially when I studied till 4 a.m. before I had 1 hour sleep again, right? 4 a.m., most of those things show up on the NCLEX exam and they were helpful. So once you prioritize this 24 hours before the exam, right? What we are doing final preparation is 24 hours before the exam, you are studying those 34% content that repeat themselves on the exam. The morning of your exam, you are doing the same thing. The morning of my exam, I did it, right? And 1 hour before the exam, right, you are going to do it as well too. 1 hour before the exam. My plan when I was 24 hours before my exam was to study those 34% content in the morning, revise them, which I did. But when it was the 1 hour before the exam, I wanted to study them again. But I never had the opportunity to study them. Instead, I was able to just reflect on what I have studied and revise. Right. I never had the opportunity to study them. So that's the reason why I put it like this. You need to study them, revise, and reflect on them. Right. So, right. Once you do this, trust me, you see, the NCLEX administer the exam question using the CAT. We call it the computerized adaptive testing, meaning the exam adapts to you. So it's the knowledge you show to the NCLEX that you have that will determine the kind of question you will get. So if you show to the NCLEX that you have knowledge in This 34% area, NCLEX will keep on repeating those questions under those 34% area, because that is where they will be testing you the most. NCLEX don't want to test you related to what they feel you don't know. NCLEX want to test you related to what you know, because only what you it's only what you know that you can show that you are safe and competent nurse. That's the main reason why if you get a question wrong, the NCLEX look for a question that is going to be easy for you to get correctly. If the NCLEX want to make you to fail, they don't care. Once you get the question wrong, they will just be giving you more difficult question. But NCLEX don't work like that. When you get the question wrong, they give you easy question, because the goal of the NCLEX is not to get you fail. The goal of the NCLEX exam is to get you to show that you are a safe and competent nurse. And in order to show that you are a safe and competent nurse, they need to test you based on what you know. So you can have somebody that is very smart and somebody that is not that smart in nursing go on the NCLEX exam, and the two of them will pass. Why? Because the exam adapted to those two type of students. So NCLEX is not difficult. Once you have the right way to prepare, which is on the screen right now, you are able to pass the NCLEX exam. Now, what are the difficulties students have here? Right? Now, one big difficulty, right, is a lot of students don't know how to do it alone. That is one. Now you can give students and say, okay, this is the whole process. And they will be like, yeah, it's interesting, but I don't know how to do it alone now. How can I do it by myself? Right? So they need somebody to like help them. Right. Two is when it comes to the content. Right? Now, a lot of students struggle to retain the information. A lot of students struggle as a slow learner. And some struggle with understanding. Right? There are some students, they can retain information, but they don't know how to understand it. There are some students that they cannot understand because they cannot. There are some students that tend to understand, but they cannot like retain the information. And there are some students that they are slow learner. Right? All this affects you to prepare right. If you cannot retain the information, it's going to be a problem. If you don't understand what you are studying, even if you have the right thing you are studying, it will be a problem. If you are a slow learner, you will be like thinking you are behind and you want to rush the process, and when you rush the process, you fail and it become a problem. So those are things students face with content. Now, retention. If students is struggling with retention, the solution is very simple. The solution is simple. Now, all you just need to just do, if this is what you are studying that is making you not retain, just divide it into two. Study this first before this, and see how you retain the information. Now, if it's that you are still not able to retain the information, divide it again to 4. Study each part and see. Study the first part before you study the other part. See how you retain it. When you keep dividing, you'll figure out what you can retain, and that become how you study. When I was trying to study fluid and electrolyte, I noticed that I could not study all of fluid and electrolyte once. I studied it for 6 months. I still did not understand what I was studying. When I realized it was a problem, I was like, oh my God, I am not a fan of mnemonics. I'm not a fan of cramming or memorizing. I want to understand, because I'm a fan of understanding, and I could not understand this. When I was able to understand this or retain the information was when I broke it down into two. I did not study both fluid and electrolyte together. I focused on fluid first before electrolyte. And when I was even studying the fluid, I broke it into parts. I firstly start by understanding how important fluid is, right, to the body, right? Why are we talking about fluid in the first place? How important is fluid to the body? What are problems clients we experience with fluid? Right. So that is how I started learning. Then it now made sense to me why electrolyte was important. And then studying electrolyte, my brain was so excited to study it. And that's how I was able to train my brain to retain those information. Right. So so that is how you get to retain. Now, understanding, most times students don't know how to understand, not because everybody don't have the ability to understand. It just happened to be how you were being trained in the first place. Sometimes most students are just trained to know the information, and all they are left to do is to go memorize and cram. So now when it comes to understanding, it's difficult to understand. They're also left with memorizing and cramming. But when you were in nursing school, you prepare for exam based on the course. So sometimes you might be taking 4 courses, eight, at least not every of the or not like 16, not like 20. But now when you are preparing for the NCLEX exam, you need to like know everything, like everything you study in nursing school. Right. So now you are like, how do I get to now learn everything when I was struggling in nursing school? Right. Now, and then it become a problem for you to understand what you need to study. Right. So students that struggle with understanding, right, they also need somebody that is going to like explain what they are studying in a clear way so that they understand it and they can be able to use that content knowledge to pass the NCLEX exam. Now for slow learner, all they just need is more time. Right. If you recognize yourself as a slow learner, all you just need is more time. So while you have somebody studying for 60 days, you might need 90 days because you don't want to rush through the process. As a slow learner, you don't have problem with retention, you don't have problem with understanding. It's just that you are very slow in studying. That's all. So all you just need to do is to give yourself more time. Right. If you can give yourself more time, you'll be able to pass the NCLEX exam. Right. So that's the problem many students face with content. But once this is solved, they now understand content and they are ready to answer question. Right. Now, problem students face with question, like I said, you will have some certain students, right? It's just like now, let us say you have a question on the screen right now. In order to answer this question, you need to know what the question is testing. Student A might say, oh my God, I don't know what this question is testing. And then student B will say, yes, I know what this question is testing. Now, student A will not have the ability to answer this question. We'll be left with guessing because student A don't know what the question is testing. But student B will have the knowledge and be ready to answer the question. Now, student B, sometimes student B can have the knowledge and still have difficulty answering the question. And sometimes the student B will have the knowledge and have the ability to answer the question. The reason why they might not have the ability to answer the question is because knowing what the question is testing is not enough to answer the question. As you need to understand what the examiner is asking and what each answers are saying. If you don't know those three things, right, you will still struggle despite the fact you know your content. And that's why you have students saying, I know the content, but I still struggle to answer the question. Right. So, in order to answer any NCLEX question correctly on the NCLEX exam, you need to be able to figure out these three things. One, what is the question testing? Two, what is the examiner asking? And three, what each answers are saying. Right. So, and when you are trying to figure out these things, you are thinking as a nurse, not as a nursing student. You are not trying to find information, you are trying to understand the care, why you are doing that particular thing. That's what you are trying to understand. It's very simple. But many students only think about the information. They don't think about the uh the reason why they are carrying out that nursing activity or that nursing care or that nursing action or something. Right. So that's it. But once all those are solved, everything is good. So that is how you study. Now, once you know how to study, right, next will now be, so once you know how to study, the next thing that you are going to have right now will now be your, let me remove this one. So once you know how to study, now next will now be your part two, which is how long should you study for? It can be in days or weeks. Now, how long you study for depend on your current situation. And there are three things that play a key role to your current situation: yourself, family, work. Right. Yourself, there are three things. Do you understand what you are studying? Do you struggle with retention, or do you struggle to as a slow learner? Right. So now recently I added one thing to this, which is, how do you feel about the NCLEX exam? Because I noticed that many students don't feel so good about the NCLEX exam. They're just hoping that a program can just help them pass. So they are not really putting the effort. Their mind is so lost that they just feel like somebody else will just help them pass. So they are not ready to put in the effort. So it's how they feel. If you don't fix this part, they will end up using that program and they will still not pass because their mind is not yet made up to take their next attempt. They are still trying to like feel through the pain of failing or feel through the pain of not knowing how to pass the NCLEX exam. So once you fix this, that is when you can now do this to see this three parts. If they are having problem with this, and you fix this for them, right? Once this is fixed, now this part, right? Family, right? It might be maybe the person have major family responsibility or not, right? So if there's any major family responsibility, that will influence how much days a week you are spending to study. So if you have major family responsibility, you need to now ask yourself, how much time do you think you have to study, right? How long do you think you can study for? Right, you think maybe studying for 60 days will be enough for you to pass the NCLEX exam, despite the fact you have family responsibility, right? So the minimum I wish is to advise students to study for is 60 days, but based on family responsibility, it can be more than that, right? And even with work as well, if the person is working, right, it can be more, and if the person is not working, right, it can just be like this. I've seen students who join my program 60 days, they took the NCLEX exam even before that 60 days and they passed. So it all depends on the student, right? So that's why we need to look at the amount of days you need to study if you have family responsibility and work, right? And the third part is the third part is how many hours per day can you study? So it's also the same thing. Current situation, yourself, family, and work. So based on yourself, right? Like, do you think um you can study for 1 hour and understand something, or it take you 2 hours, 3 hours, or more? Right. Do you have family responsibility that make you study less? Or with your family responsibility, do you think you have time to study? Right, like I said, the amount of time you have to study, if you have family responsibility, will influence how many days you need to study for. Like if you are to study for 1 hour a day, right? If the way you understand information is very good, you can still study for 60 days and pass the NCLEX exam. But if the way you understand the NCLEX, things about the NCLEX is not that fast, then if you study for 1 hour a day, then you need to study more than 60 days. Right. If you struggle with retention and you have to be breaking everything you are studying into parts, the amount of hours you're going to be spending each day will be less. Let's say students struggle with retention. Students that struggle with retention should not study for many hours a day. Instead, they should study for little hour, but more days. Because if you struggle with retention and then you are trying to study everything that day, you will forget everything again the next day. And then you will feel like nothing is sticking, this and that. And students reach out to me and they're like, oh my God, everything I studied yesterday, I just all of a sudden forget about it. Coach, do you think I'm ready to take this NCLEX exam? Because I'm struggling. The problem is how they are feeding themselves that information. Right. Some people rush through the process. These are things many students don't know that contribute into failing. Right. For your work as well too. Your work is it giving you time to study? Right. How much time do you have to study? After work, do you feel like you have more hours to study or less hours? So based on all this information, then you can now be able to have the amount of days you need to study and the amount of hours you need to study. As a slow learner, you either can decide to go less hour or more hour to study. It does not matter. Somebody that struggle with retention cannot go long hours, short hours, but more days. Slow learner, either less or more, but more days. If you struggle with retention, you go little hours, but more days. And if your understanding is not that good, then you need you can either do less hour or long hour, but more days. But if your understanding is good, you don't need long hours, you just need less hours and the normal 60 days in order to take the NCLEX exam. So this is like a guide to now figuring out how you get to how many days you need to study for, how many hours you need to study. Right now, the final part is this. The final thing I want to say is this. Let me erase this. Now, the final thing I wish to say, I want to say is this. Now, when like I wish to tell students that the goal of your NCLEX preparation is for you to be able to go on the NCLEX exam and be able to answer question correctly. Right. In order to achieve that goal, right, you need to be able to understand the NCLEX, the content, and the question. Right. So once you understand those three things, you have the ability to prepare the right way, go on the NCLEX exam and answer question correctly. So once you've done this right, when you go on the NCLEX exam, the only thing you are doing, you are no more understanding the NCLEX when you are taking the NCLEX exam in the exam room. You are no more understanding the NCLEX again. You are no more understanding the content again. Instead, you are answering questions. And when you answer those questions correctly, you have the ability to become a licensed nurse. So now when you are in the exam room, the only thing you are trying to do is to know what the question is testing, what the examiner is asking, and what each answers are saying. Right. And you are able to do this when you understand how the NCLEX writes the question and how to break down the question. Right, we'll talk about the NCLEX right question, nursing activity, how you act, and safe and competent nurse. So, which brings you to know the body of the question, the stem of the question, and the answers. The body of the question is like a short or long scenario that describe a particular situation. When you read that situation, you'll be able to understand, oh, this is what the NCLEX examiner is trying to test me. You know that. Once you know that, you know the knowledge. Now you are ready to read the examiner question, which is the step that tell you what to do related to what the question is testing. Now, when you understand what the question is testing and what the examiner is asking, now you can now use that understanding to go through each of the answer one after the other and figure out which answer is correct related to what the question is testing and what the examiner is asking. Right, that is how it works. So now I will switch my screen now to question right now. Any question for now?
No.
Okay. So let me switch my screen to so the final part of the preparation is to practice NCLEX past question. Like I said, once you have all this knowledge, all you just need to do is to start practicing past question. Let me know if you can see my screen.
I can see it.
Okay, great. Right. So we've answered this question before, but I just want you to demonstrate again. Right. The three parts to every NCLEX question. One, the body of the question. Two, the stem. And three, the answers. So I will demonstrate how we use this. So the body of the question, like we said, is like a short or long scenario that describe a situation. That situation will tell you what the question is testing, which is that nursing activity. Right here is the body of the question. And you can see it's a short, not too long scenario. It's describing a particular situation. In this situation, you can see that it's saying we have a charge nurse. and the charge nurse is doing something. That's the nursing activity. What is the charge nurse doing? Like NCLEX always used to have the who. The who can either be the charge nurse, it can either be the nurse, or it can be staff member. Staff member. Right. All these people are going to carry out a specific nursing activity. So when you know your who is the who in this question? The charge nurse. This charge nurse is carrying out a specific nursing activity, and that nursing activity is she's receiving change of shift reports. Right, and she's not just receiving change of shift report to any random client. They describe the kind of client she's receiving reports on. So when you have the who, you have the nursing activity, and NCLEX will 90% of the time describe if it is related to the client, 90% of the time they will describe the client. 10% it will just be random client, right? Or let me just do it this way. Let me just say your question, let me say 80% of your question will be related to the client, whereby they are going to describe the client. 10% will be clients that they will not describe. It will just be a random care for random client. And 10% will be related to it can either be related to the nurse, the charge nurse. It can be related. Let me just say it's healthcare workers. Instead of just writing out, let me just say it will be related to the described healthcare worker in the question. Healthcare worker in the question to be related to the healthcare worker. Like now, this question have the charge nurse, so that's the healthcare worker. So what's the healthcare worker doing? Right, receiving change of shift report. Now, this is the nursing activity NCLEX is testing. Change of shift reports. Now, this is what you need to study. I will go to the let me do so. Let me erase all this. Right, I will go to the NCLEX past question now. Sorry, the test plan now, so that you can see change of shift report in the content list. Right. So that you can see change of shift report. That's the nursing activity NCLEX test. So it's under management of care. Right. This is the content right here. Provide and receive end of care report on assigned client. That is it right here. So if you have studied this content, it will be impossible for you not to answer this question, because you study the content. This is the content. So if you truly study that content, it will be impossible for you to answer the question. Now, you see, when they're talking about the report, they said you can either provide or receive. But NCLEX here is not talking about providing, instead it's talking about receiving. Now, change of shift report is related to either providing or receiving. Now, the two all lead to continuation of care, but somebody that is providing, if NCLEX want to test you as the provider of the report, it means NCLEX will, instead of NCLEX asking you to prioritize, NCLEX will tell you which of the following information about the client is important to tell the next staff. The next staff are the ones that will take over the care. Right. That is how providing report type question show up on the NCLEX exam. But when you are receiving, it means you are the one taking over the care. And when you are taking over the care, all you are pretty much thinking is how are you going to prioritize your care, and if there's anything you need to delegate. Right. So you look at the list of clients they gave to you, you decide who are you going to prioritize? Is there anything you need to delegate? That is what you think when you get reports. And that's the reason why the NCLEX examiner is saying the charge nurse should ask a staff member to foresee a particular client, which is what? Prioritization. So this is the report she got. So she's asking another staff member to see one of those clients. So NCLEX is now putting you in this question as the charge nurse for you to decide which client would you tell the staff member to prioritize. That's what NCLEX is doing. Now, but prioritization, in order to prioritize, right? In order to prioritize, right? You need to understand the kind of care you are carrying out. You cannot just prioritize it like that, because prioritization is related to everyday life. You can decide, oh, should I go to church or I should go to work? When you decide to go to work over church, that's your priority. If you decide to go to church over work, that's priority as well too. So that's prioritization. Should I take my child to school, or I should go to the bank first? You decide to take your child to school, that's your priority at that point, right? Prioritization is related to everyday life. So when we talk about prioritization, we need to talk about prioritization related to what we are prioritizing. In this case, it's related to care. And that kind of care we are trying to carry out is related to who? Client in labor. So when we are trying to apply prioritization in this question, our thinking should be related to client in labor. That's how it works. So now, in order to prioritize based on client in labor thinking, you need to understand this care. And NCLEX have that content as well to write here. It's under edge promotion, client in labor. So everything NCLEX want to test you is on the content. See, clients in labor. So if you studied how to provide care to clients in labor, you will still be able to answer this question. So there's no an excuse when students go on the NCLEX exam and they are having difficulty answering questions. The only reason why they are still having difficulty answering questions is because they have not studied the right content. When you study the right content, everything is clear. You can see this is there. This right here is there. This is there. So it means that if you've studied that test plan, you have the right knowledge to answer this question now. So now, the difference between nursing school question and NCLEX question is that you can answer nursing school question directly, but NCLEX question, you need to understand the answer first before you answer it. So now, when you want to understand this answer, the first thing you want to understand, okay, first stage of labor who has an oral temperature of 99, you understand this as vital sign. What kind of care does this fall under? Vital sign, because okay, we need to carry the vital sign was done for vital sign was done right here, and the vital sign is what? The temperature. So the ability to answer this or think about this answer depend on your knowledge of vital sign, because we have 5 vital signs. We have the blood pressure, we have the pulse, we have the, let me say, respiratory rate, we have the oxygen, and we have the temperature. Right, we have the temperature. Right. So your ability to think about this is when you understand. So this is testing normal range. So if you know the normal range for this, for this, for this, for this, for this, you are good. Now, you see, oxygen and temperature normal range don't change. The only time oxygen normal range change is if you have a COPD patient, which become 88 to 92%. But other than that, oxygen normal range remain 95 to 100%. Temperature don't change as well too. Temperature remain 97 to 100.4. 100.4 degree Fahrenheit. This can change based on the kind of client, maybe pediatric, adult, the pulse as well can change, the respiratory rate can change. Even based on the care, it can change. But you see this, the only reason why oxygen can change is if you have COPD client. Other than that, it remains the same. Temperature don't change. So there's no need to think too much here. Just ask yourself, what is the normal range for temperature? 97 to 100.4. And this is 99. So it's within range. That will not be your priority. Right? Now, the next answer is talking about contraction. Contraction occurring every 30 seconds. If you have studied client in labor, 100% you would have studied contraction. And contraction is measured in 2 ways. Contraction is measured in frequency, and contraction is measured in duration. Frequency and duration. Now, frequency is described as every, duration is described as lasting. So if I want to know what kind of contraction NCLEX is testing here, all I just need to just see is there a keyword every, or lasting. Now they said contraction are occurring every, so it means NCLEX is testing frequency. Right. Now, so like I always used to say, NCLEX is not nursing school exam. NCLEX is nursing care. So NCLEX don't care about you knowing the normal range for each stages of labor. NCLEX just wants you to know the combination, normal range for the combination of all stages. NCLEX is not giving you points for knowing the normal range for each stages. NCLEX just wants you to know what is safe. So NCLEX wants you to know what is safe from first stage all the way to the final stage. So what is safe from first stage all the way to final stage is 2 to 30 minutes. And for duration, what is safe is 30 to 90 seconds. Right, that's what is safe. Right, you will see some people start telling you 2 to 5 minutes, 2 to 3 minutes. No. NCLEX don't work with stage by stage. NCLEX work with the combination, what is safe. Right, so it's 2 to 30 minutes. Now you look at it for frequency. This is 30 seconds. This is not within range. So this look like a problem. So we are going to come back to that. Right, now respiration 26. Right, like I said, respiration is part of the vital sign that can change based on the kind of care. So before we just assume that this is bad, because normally your respiratory rate for adults is 12 to 20. Another thing you need to know is when NCLEX did not describe the age group or the age of the client, then NCLEX want us to assume that that client is an adult. Age means maybe they tell you the client is 12, 22, 30, 76, and so on. Age group is when they tell you neonates, right? Pediatrics, adults, right, and so on. Right, that is age group. So when they did not describe, based on the age group, you can know the age, because okay, a neonate is from 0 to 30, right, or 1 month, right, and then from there you have like your after your neonate you have like your toddler and so on. Right, now based on the age group, uh sorry, you have your infant, sorry, 0 to 30, that's like your neonate. From there you have like your infant, and then you say like, oh, that's from 1 to 1 year, and then so on, toddler 1 to 3, and so on. So based on the age group, you end up knowing the age. And if they don't give you age group and they just give you the age directly, you know the age. But here they did not describe age group, they did not describe the age. So we can just assume it's adults. That's the reason why I said the respiratory rate here is 12 to 20, but this is for adults. And this is high. But you cannot just assume it is bad, except if there is sign and symptom showing that it is bad or causing a problem, or if it is not normal for the kind of care. So there's no sign and symptom here. So patient is still safe for now, but we don't expect the patient to be having 26 if it is not normal for the kind of care. So that's why we need to evaluate if this respiratory rate is normal for this kind of care, which it's normal. Why? It's not a concern. Why? Because during labor, there's high physical activity, there's pain, there's exertion, there's anxiety that cause respiratory rate to be high. If you are scared now, your respiratory rate is going to be high, because your heart is going to be beating so fast, you're going to be breathing very hard. Does not mean you have sickness or you have respiratory problem. It's just because you are scared. Right. So that's how it works. If you go to the gym, your respiratory rate is going to be high. Does not mean you have respiratory problem. It's just because you did a particular physical activity. Right. So same thing applies to labor as well too. There's high physical activity, stress, pain, anxiety, that's what contribute to increased respiratory. So this is expected and not a concern. So we've X that out. Now we have the last answer, which is second stage of labor whose contraction are lasting for 60 seconds. So this is also testing contraction, and we want to know if it is every or lasting. So it's testing lasting. So lasting means duration, and the normal range for duration is 30 to 90 seconds, and 60 is within that range. So this become no concern. So you are left with one answer, which is answer 2, that tell you that is the patient to prioritize. You see, the way we think through the question, we started by understanding what the question is testing. We then figure out what the examiner is asking. And from figuring out what the examiner is asking, we went through each answer to know what each of them are saying. And when we know what each of them are saying, we apply them to what the question is testing and what the examiner is asking to decide the correct answer. So now I want to know, is there any concern related to doing everything we have been discussing so far, so studying the content and answering questions?
No, just easier now to figure it out how to do it, how
Right.
to break it down, each question.
Okay. Now, like I said, right, breaking down NCLEX question is all about what the question is testing, what the examiner is asking, and what each answer is saying. If you cannot be able to do that, that will be what is causing you to struggle. But the question will not be strange if you know the content. And like I said,
Right.
the content is right there on the NCLEX test. Now, once you know the content, you can be able to identify them in any question. If we go to the next question right here, right, you'll be able to identify the content as well too. Why? Because there's one thing you should learn. We have different kind of conditions. We have medical condition, we have surgical condition, we have infection. So if you have a condition in your question, you have to ask yourself, is this a medical condition, surgical condition, or infection? Because when you are dealing with medical condition, the way you think about medical condition is different from the way you think about surgical condition as a nurse, and the way you think about infection as well is different. Right. Now, when you are caring for medical condition, you pretty much want to know about the condition, the body system that is affected, right? The major concerns and major danger, and then the intervention. That is what you need in order to answer any question related to medical condition. Right. Now, for surgical condition, all you just need is to know your pre-operative care and post-operative care. That's all. You have no business with the name of the surgery. All you just need to just identify that, oh, this condition right here, the NCLEX is testing, is a surgical condition. And all you need to do is to read it. Are they asking you to care for this client before surgery or after surgery? From the question, you'll be able to identify that. Let me show you one example right here. Let me show you one example right here. Now, if you look at this question right here on the screen, now, when I ask students, what is this question testing? The student went through the question and said, this question is testing about colon recession. And I asked one question. So as the nurse now, since you said this question is testing about colon recession, what are you doing to the colon recession? Because you cannot do anything. NCLEX test you related to nursing activity. So if you understand that NCLEX test you related to nursing activity, you would not tell me that this question is testing colon recession, because is this your nursing activity? No. So you see why many students struggle with answering questions, because they don't know what the question is testing. Read the whole question. The body of the question contains a scenario that describes a particular situation. So what situation is here? We have the nurse. What's the nurse doing? The nurse is assisting with the admission of a client scheduled for colon recession. So she's assisting with admission. That is the nursing activity. This is the who. This is the healthcare worker. This is the nursing activity, and this is the client situation. So the client situation will tell us how we are caring for the client. Now we can describe this as a surgical situation. Now, when we think about surgery, in our head, we are thinking about pre-op, because that is what nurse can do for a client that want to undergo surgery. Pre-op and post-op care, that is our nursing activity. So when they tell me colon recession, I'm like, oh, colon recession, that is not a medical condition, that's a surgical condition. Immediately, my thinking is activated as pre-operative care and post-operative care. Now, they now said, now, how will I know if it is pre-operative care I'm carrying out or post-operative care? They said, one, during admission. Two, they said the patient is scheduled for the surgery. It means the patient has not done the surgery yet. So when the patient have not done the surgery yet, we cannot do post-operative care. It's only when the patient has done the surgery we do post-operative care. So since the patient is scheduled, it's pre-operative care. So NCLEX wants us to apply pre-operative care knowledge to answer this question. That is how NCLEX work. So, but if you fail to understand the nursing activity NCLEX is testing here, it will be, you will read the question, but you will struggle. The goal is not to go on the NCLEX exam to read the question. The goal is to understand the question. Right. So that is how NCLEX work. So this question, once you see the condition now, you are now like, oh, this is an infection. If you know how to approach an infection, you'll be able to answer the question. Infection all starts from the precaution. That's the key. When I see it's an infection, the first thing I'm thinking is, oh, is this question going to test me about precaution? If it's going to test me about precaution, then that's what I need to do. Right? Precaution. Once I'm done with the precaution part, the next part will now be intervention. That is what NCLEX, that's how the care work. Intervention and evaluation. Right. Medical condition as well too. You want to know about the condition. You want to know about the body system affected. You want to know the major concern. You want to know the major danger. You want to know the intervention, and then you want to do the evaluation. So that's how it works. Surgical condition, this is for medical condition, this is for infection. Surgical condition, you want to know pre-op and post-op. That's all. Right. So when you know all these things, you know how to approach the question. Now, this is an infection. So now we ask myself, are they asking me to do precaution, intervention, or evaluation? That is your roadmap in answering this question. Now, all this question in the intervention is the treatment that we use to fix the infection. The intervention right here as well too is the treatment that we use to fix the condition or sign and symptom. It can either be the concern. Right. That is the intervention. Right. So that's what the intervention is all about. So all these answers, are they answers to treat the condition, or are they answers that talk about precaution? Are they answers that talk about treatment, or are they answers that talk about evaluation? You will agree with me that these answers are talking about precaution, because none of these answers is talking about treatment. Place the client in a monitored negative pressure room is talking about precaution. Face shield is talking about precaution. And Rob, alcohol-based syndrome is talking about precaution. The surgical mask during transport is talking about precaution. None is talking about intervention. So we can agree that this question is not testing about intervention. Evaluation is testing about precaution. So if you studied about infection control, you would have learned how to prevent the infection. So based on that knowledge, you'll be able to answer the question. Infection control is divided into three parts: your airborne, your droplet, your contact. So now, in order to know the right precaution, you need to know where this infection fall under. Is it airborne, is it droplet, or is it mixed? Some are mixed, and the mix is either airborne and contact or droplet and contact. In this case, this one is airborne and contact. So that is the precaution you are going to apply. So now, since you understand that, you don't just want to jump straight into answering the question because you know what the question is testing. You still need to know what the examiner is asking. The examiner is not saying which of the following actions should the staff member take, right? Which action by the staff member would require the nurse to intervene? Meaning, this staff member have done something wrong right here, and the nurse will need to intervene. So now, what we are looking for is that wrong thing that the staff member have done. The condition, airborne, and contact. The NCLEX is saying select the wrong action. So now we need to ask ourselves, is this a wrong action? 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 So now, in order to know, give yourself confusion, just write correct action, and put wrong action. So any correct action, you write it under here, and any wrong action, you write it here. So this one become your answer. So now this is testing about room. Monitor negative air pressure. So is this a correct action related to chickenpox? Obviously, yes, it's correct related to airborne. So number one is the correct action. This is talking about PPE, which is face shield. Is this a PPE that used for either airborne or contact? Airborne, we use N95. Contact, we use glove and gown. So it's not a correct action. You put it here. Now, alcohol-based hand rub, is that a correct hand hygiene for airborne? Yes, because for For hand hygiene, we use both alcohol-based hand rub and soap and water. The only time you don't use alcohol-based hand rub is when the hand is visibly soiled or you are dealing with norovirus or C. diff. This is not norovirus. This is not C. diff. There's nothing like visibly soiled, so that is applicable. That's the correct action, so we'll put it here. Now, the fourth one is saying placing a surgical mask on the client during transport. Now, during transport, we use surgical masks for airborne condition and droplet condition, and this is airborne. So this is applicable. So this is a correct action. And remember, the NCLEX asks us to select the wrong action so that the nurse can intervene. This is the only wrong action. So this X out, X out, X out, and you are left with this. Is that something that you can do, or there's still more problem?
That's something I could do.
All right. So is there still any other issue? Let me know.
No.
Right. Like so far, so good. What will still be stopping you from answering questions, like I said, will be how you, maybe if you are studying the content, that's one. If you are studying the content, are you actually studying the content? Two, are you understanding it? And are you implementing what you learn? Right. That's just the three things. Right. So, but other than that, if you are doing those things right, you will have no difficulty to take the NCLEX exam and pass. I've helped a particular student who failed the NCLEX exam 15 times. She's from the Philippines and she was able to pass the NCLEX exam, even when she complained that the English language was a problem. I've helped a student who took the NCLEX exam 12 times and passed on a 13 attempt as well, too. Right. So, if this student can actually pass the NCLEX exam, right? Trust me, I always used to say, there's nobody that should fail the NCLEX exam because there's always a reason why students fail the NCLEX exam. And once that reason can be fixed, you get to pass the NCLEX exam. It's always one of these three things. There was a particular student that said he fixed his exam on the 18th of last month. And I said, okay, let me meet with you for to discuss some certain things. And I pull up this content and I said, okay, let's talk about each of these contents. What do you understand about the first content? Integrate advanced directive into the client plan of care. He could barely even say anything. What do you understand about the second content? He could barely say anything. I already knew that person cannot pass the English exam. Right. So how do you help yourself when you don't end up studying the content? And studying the content is not difficult. It's a simple process. All you just need to just do, pick this content, copy it, paste it on ChatGPT. ChatGPT will explain that content the way NCLEX wants you to understand it. And then you can still ask that same ChatGPT to generate you question that will help you out with knowledge. You can answer 15 questions related to that. You have the right knowledge. And when you see question, you will be able to answer them related to that question. Right, related to that content. You do that for every of these contents, you learn them, you will have knowledge. You will go on the NCLEX exam and have the ability to pass. Right. Now, if you're having difficulty, maybe you study the content and then you're having difficulty understanding something, you can reach out to me and say, okay, I was trying to study this particular content and I don't understand this yet. So if you don't understand that yet, that's when I will now come in and I to explain it very well for you to understand it. Because the goal is to make you understand it. The goal is to make you, like do everything right. So once you can study all this content, you'll be good to pass the NCLEX exam. NCLEX is not difficult. The reason why many students don't pass is because they don't actually study the content, they don't understand the content, or they don't study the right way. That's the reason why. And it's always one of these three things. It's always one of these three things because when students come and then if you ask them to answer a particular question and they are still struggling to answer the question, you're like, what's this question testing? And they cannot tell you. How would that student be able to pass? It will not be possible for that student to pass. So one, you need to be able to understand what the NCLEX is testing, understand what the examiner is asking, and what each answers are saying. That is how you get to pass the NCLEX exam. So all these content you've studied them.
That's what I said. That's what I'm going to start doing. I'm off tomorrow. I'm just going to go through the test plan again and understand each one and what they're asking, just to refresh and
understand the content.
Yes.
It's very important if you want to pass the NCLEX exam. Yes. This is all what I study. This is what students who have passed under me study as well too. Once you can study all this, you will have the ability to pass the NCLEX exam, right?
Yeah, I think
Because this
I'm
is
gonna
what
go
show up
back
on
to
the
that.
NCLEX exam.
Hmm.
Right. And you know the number already. You can just divide them. You can say, okay, this is
Yes.
the part you're going to study today. That's the other part. That's how you just do it, right? And
Okay.
if you are having any difficulty despite studying the content and you are trying to answer questions related to that content and you are still not understanding it, then that's when you reach out so that I can be able to
Okay.
explain.
Okay.
Right. In order to study content, right, there are two things you need to know. Let me put it here. When you are studying content, one, you want to have understanding of the content, plus you want to have understanding, you want to understand the key, right? Like integrating advanced directive is the key, but the content is advanced directive. When you're studying advanced directive, you want to know the definition, the type. That's what you want to. That's the basic understanding. But the key is now how do you now implement this into a client plan of care? That's just the care. But if you don't know this, the care will not make any sense. You understand? Because if they tell you, can somebody sign consent for a client who is competent, right? You might have difficulty understanding this if somebody can sign consent form for the client who is competent, right? So, but if you understand what advanced directive is, advanced directive is a document that states what the client wants and what they don't want when they are incompetent. So advanced directive only exists or can be used when the client is incompetent. So if they tell you a durable power of Anthony want to sign consent form for a competent client, you will say no, this is wrong. Because before a durable power of Anthony, which is one type of advanced directive, can sign the consent form for a client, the client have to be incompetent for this to happen. So it's your understanding that give you the ability to say this is wrong. Am I clear?
Yes. Very
All right.
clear.
Okay.
Hmm.
So now, like you said, tomorrow now you start studying the content.
Yes.
Okay,
I'm gonna
so
go through
this
each one of them, like you said, and break it down. Me
okay.
is retaining. That's that's my problem. So that's why I'm gonna go through each one, pick
Mm.
about 4 or 5, and just do it that way, and then just try to understand, and then do questions from that, and put it in Chat GPT, as you said.
All right. Okay. So
So
this is
that's
the
a
one
good
you are
idea.
doing. One, two,
Yes.
three, four, five.
Yes.
Right. So I will when you are done with this, right, I would like
Hmm.
to understand what you understand know about this content. So
Okay.
yeah, I will evaluate your knowledge related to this content and give you idea on how to approach questions related to this content.
Okay.
Right. So do that tomorrow. Right.
Okay.
Make sure you do that tomorrow so that at
Okay.
least I can evaluate you related to this.
Okay.
All right.
All right.
All right. Any question before I go?
No favor. Thank you so much. I appreciate you.
You're welcome.
Yes.
All right. So I'll talk to you again tomorrow. Okay.
Okay. No
All right.
problem. Have
All
a
right.
good one. All
You
right.
too.
Bye.
Bye.